Hi, Matt again from Glaucoma Pirates. Coming at you now with video number 5, which is the next stage of my glaucoma journey, following on from video 3, which was my diagnosis and initial visits to the hospital and problems with acetazolamide and everything else. So we left off there with being sent home with a load of eye drops and being told that I would be referred, and in about a month's time I'd be called back for a follow-up to see a specialist. So anyway, that was in April 2021, sorry. Basically, NHS is brilliant, but because of COVID and because we've been very busy and there's long queues and waiting lists. Unfortunately, I hadn't heard, I hadn't been called back or had a letter or anything for 3 months after, although I was told it was a month. I did ring them a couple of times and they said, oh yeah, we're very busy, sorry, but you should be hearing something soon. So in the end, anyway, in June that year, I decided to use my private health insurance, which I had, made an appointment to see somebody as a follow-up to continue my glaucoma journey and get seen. They were great. I'm not going to name hospitals, but yeah, that was a really good experience for me. Really helpful doctor, did all the tests, did all the scans again, and the scan of the optic nerve and the field tests, and confirmed that that I did have glaucoma, that there was a slight nerve damage. At this stage, they'd noticed that I'd started to lose some peripheral vision in my left eye. I hadn't really noticed, and it's one of those things that sort of happens slowly, so you don't notice straight away. The way you do notice is if you start to sort of concentrate and look at things with one eye and look at things with the other eye, then it becomes more noticeable. But I think your good eye makes up for what you can't see and sort of fills in the blanks. Quite an interesting thing about it. I didn't realise how bad my peripheral vision loss was. I was in a waiting room at a hospital and there was a big picture of a sky scene with clouds on it, and I was sitting there just waiting as you do, and I thought, well, I'm just going to look at this, and I looked at these clouds with my right eye covered up and my left eye covered up, and it was crazy. There was gaps in the clouds where you could see sky through, and when I was just using my right eye, which is my good eye, I could see all the clouds and all the gaps completely clearly where everything should be. And then when I covered my right eye up, my brain was filling in all the gaps of what it thinks should be where, and it was a completely different cloud. It was a completely different cloud with my right eye than it was with my left eye, and it just emphasised to me how clever your brain is, and it tries to fill in the gaps, and it thinks, oh, there should be cloud on that bit, and it puts it there, but it's not there, and it's not there because you looked in your other eye. But anyway, that's besides what I'm talking about today. So the upshot of seeing the private specialist was that he wasn't happy with how the drops were controlling my pressure. My pressures are still quite high, so he booked me in for an emergency SLT, selective laser trabeculectomy, I think that it stands for. It's basically a laser surgery. It's done without any anaesthetic. You don't need anaesthetic for it, and basically you go in. It's sort of like one of those machines that's like an eye exam machine, except it shoots lasers into your eye, I believe into the drainage tissue inside the eye, to try and stimulate it to allow fluid to flow out. The actual procedure itself took about 20 minutes, maybe half an hour, and consisted of him zapping the eye with a laser, and you can hear the beeps as it's happening. I think it was about 120 shots all around this part of the eye, and they say it doesn't hurt, and I think a lot of people it doesn't hurt. I was fine for the first few zaps. I'd say the first 10 or 20 zaps didn't feel a thing, and then I started to notice every time the zap went off, it was like someone sticking a pin in your eye. And by the last sort of, the last 20 or 30 zaps, my eye was starting to really throb, and my head was aching. I think I probably felt a bit sick just from the pain. But I bared with it. It wasn't too bad in hindsight. I did say to him afterwards, "Is it supposed to hurt?" I didn't think it's supposed to hurt, but it was really bad. And he said, "It can." He says, he said to me that he was being quite aggressive and that he was using it on quite a high setting, because he thought I was tolerating it, because I was being a brave boy and putting on a brave face. Some advice with that is, if it's hurting, put your hand up or something and tell them straight away, and they will lower the setting to make sure that it's not hurting too much. But I did, after the surgery, I was asked to sort of wait for 20 minutes, and then they were going to check my pressure again. So I just had to walk around, cleared my head, and I'd say, about half an hour after, all the pain had gone again. So it was like very temporary, but it was quite a horrendous headache pain on my eye for that 20-25 minutes or so. They checked my pressures again. It had gone down a little bit. I can't remember the exact pressures, but it was something like 30 something, early 30s before, and then it was like mid 20s after. So he was quite pleased that it would work, and he said it will continue to come down, hopefully. So I was then sent home. I think that's one of the only sort of procedures that I've had done that didn't include any anaesthetic at all, and also that I could drive home from, which was nice, so I could get back. So SLT is generally fine. 95% of people don't have any pain, and it's just a quick, easy option to try and get your pressures down. Be honest with them, which I wasn't. If it starts hurting, put your hand up. I didn't, so he thought he could push it a bit further, and that's why I had that headache for half an hour. But in the grand scale of things, half an hour headache, I think it was well worth it at the time to try and get the pressures down. So that's my experience with SLT, really, which was the first thing that I had done. I think I'll leave this video at that and just entitle it SLT. I'm sure I've missed certain aspects. There might be other questions you've got for me. Please feel free to put them in the messages, and I'll see if I can get around to answering them for you. But that's the end of this video. So thank you very much for watching, and see you next time. Don't forget to subscribe. Cheers. Bye.